चलो कुछ तो चालू हुआ.
Good evening and welcome to a special International Women's Day webinar series presented by Apollo Hospitals. I'm delighted to be your host for today's session, which focuses on an important yet often overlooked aspect of women's health, pelvic pain and periods. Many women experience pelvic pain at some point in their lives, but the causes, severity, and impact on daily life can vary widely. Menstrual cycles, underlying medical conditions, and lifestyle factors can all play a role. Today, we aim to break the silence around this topic, offering expert insights and empowering women with the right knowledge. It is my absolute pleasure to introduce our distinguished speaker and superwoman, Dr. Rooma Sinha, consultant obstetrician and gynecologist at Apollo Hospitals, Hyderabad. With decades of experience in women's health, she specializes in minimally invasive gynecological surgeries and has helped countless women manage conditions related to pelvic pain and menstrual health. Dr. Rooma Sinha, thank you so much for joining us today.
Thank you, Asha, and namaste to everybody that has joined us today. And I'm so excited to talk to all of you about something that you would like to know. Thank you so much.
Ma'am, the first question we have for you today is what is pelvic pain and what are some common causes behind it?
Pelvic pain in women can be any pain below their umbilicus, so below their belly button. In that area, either anteriorly towards the stomach or posterior towards the back, radiating to the thighs and legs can be defined as pelvic pain. Pelvic pain can be sometime acute, it happened just now, or it can be chronic, it has been happening for months together. The common causes of pelvic pain, as we all understand, and women tend to blame, are your reproductive organs, which is uterus, ovaries, and tubes. Well, they may be responsible for your pain, but but one must not ignore that this pain can be because of just muscular strain, could be because of myalgia, could be because of some bowel issues like irritable bowel syndrome, or it could be because of voiding dysfunction or something to do with bladder. So all that is there in your pelvis. They can be one of the reasons for pain.
Ma'am, how can women differentiate between normal period pain and pain that requires medical attention?
Any pain during periods when it becomes intractable. Thereby, I mean that you regularly require medication. You are unable to do your day-to-day activity, which could be your household work. You're going to school. You're missing those school and colleges. You're unable to go to office. You just somehow are so fatigued that you don't want to do anything. And that pain requires a doctor's attention.
What are the possible gynecological conditions that contribute to chronic pelvic pain?
Any pain in the pelvis generates from inflammation. That inflammation can be acute or chronic depending upon when that inflammation started. Some of the common reasons are pelvic pain of inflammation, and resulting in pelvic pain can be infection. Then there is a condition called endometriosis. There can be some tumor in the uterus called fibroids, which stretch the ligaments and cause pain. There can be many other reasons which causes some kind of adhesions between the uterus and the abdominal wall or something. Could be a previous surgery, even a C-section. These all can result in chronic pelvic pain in women.
What role does PCOS and endometriosis and pain? Sorry, what role does PCOS and endometriosis play in pelvic pain and menstrual cycles?
Okay, then let me just, now that you have mentioned two dhamakedar things, PCOS and endometriosis together, let me just separate it a little. Now, PCOS is a condition which is a metabolic disorder relating to hormones in your body. Okay, it generally does not cause pain. So PCOS will result in delayed cycles, irregular cycles, signs of extra hormone, male hormone like hair, acne, or your ultrasound may show some kind of PCOD picture. So PCOD is an entirely different situation. It generally does not cause pain. But on the other hand, endometriosis is notorious for pain. Why do I say the word notorious? Is that endometriosis is, again, as I mentioned, an inflammatory condition. It is related to your periods, mind you, not hormones, but the periods. Why I say so, you must understand what is the genesis of endometriosis. Now, supposing if you imagine this is your uterus, there is a lining inside the uterus which is called endometrium. It grows every cycle and then sheds when your periods come and there is a passage to come out. But when this endometrial lining is available outside your uterus, they also grow, they also bleed, but there's nothing to come out. So they collect outside your uterus, and because of its sticky nature, organs get adherent, they form cysts, and that's the reason for pain. Why it is notorious? Because number one, it gives severe pain around the time of your periods, and later with increased problem can become acyclical. Second, There are medications to help, but most often you require surgery. But remember, surgery is not final. It can recur. So that's why it's kind of a notorious pain which women suffer, and suffer many in silence, which you should not.
Ma'am, you had mentioned that one of the common causes for pelvic pain is inflammation. What causes inflammation, ma'am?
That's what I'm saying. So inflammation can be caused whenever the tissue are irritated by something. So it can be an infection. It can be a presence of blood where it should not have been. So these are the common reasons that incites an inflammation. And there is a chemical pathway that inflammation results. And they result some hormones that are pain-seeking hormones. And then that's how you result into pain.
Can lifestyle factors like diet, exercise, and stress impact menstrual pain?
Yes, they do. Yes, they do. So anybody who has not the abnormal type of pain, for the regular pain, we do suggest that when you have this menstrual pain, you must not lie in the bed. You must get up, do some mild exercise, take a hot shower, even doing yoga, and there are known yoga postures that can help in pelvic pain. So you must be active during your periods and not sedentary.
What are the dietary changes that a person can make, ma'am?
That's a dicey question. I'm not sure about it because I don't have much scientific. Although if you Google or if people see, people talk about taking anti-inflammatory diet. Now that's a big fad these days. And sometimes people say Mediterranean diet is anti-inflammatory or whatever. But since we are understanding that this is an inflammation-based problem, taking an anti-inflammatory diet will help. I'm not saying how much, but it might. No harm in trying.
How does hormonal imbalance contribute to painful periods?
I will not directly say that hormonal imbalance is causing the pain, but this endometriosis that I'm talking about, a kind of pain. And in fact, although we are talking on the eve of Women's Health or Women's Day, but Women's Health, March is also an endometriosis awareness month. It's such an ironic.
Yes.
So this hormone called estrogen in your body actually makes the endometriosis grow. So that's the villain there. So it's not a hormonal imbalance, but an excess of hormones or more sensitivity to this hormone for some women can make this endometriosis grow more and more. And then they suffer more and more.
What are the best pain management options for women suffering from severe menstrual cramps, ma'am?
Okay, first get moving. Don't depend on medicines all the time. Get moving. Many times, just putting a hot bag, doing yoga postures helps quite a lot of women. Next will be to take simple non-steroidal anti-inflammatory drugs in which something like Prosin or mefenamic acid is absolutely quite good. Once these two don't work, then we start thinking of some disease like endometriosis and things like that. To either prove or disprove our point, we also give contraceptive pills because that reduces the pain during periods. That reduces the amount of blood you lose during periods. So that these are some of the very common things that we would like to use in women with pain during periods.
Thank you so much, ma'am. Are there any surgeries which are used to treat chronic pelvic pain?
Oh, don't ask me about that because that's what I deal with it every day. Now, when this chronic pelvic pain or things with resulting because of adhesions, endometriosis, fibroids, they don't get controlled by medication. We have no medicine to make them disappear completely, unfortunately. So when, like I say, when women are suffering from these points, it depends upon how much is their problem and what is their desire. These two will make me decide whether they need a surgery. Then comes what type of surgery, right? So type of surgery today, all these conditions we do with minimal access surgery. Gone are the days where women should undergo an open surgery for these conditions. In minimal access surgery, traditionally we are doing laparoscopic surgery, which is still being done, but we now have an advanced form of laparoscopic surgery called robotic surgery, which is, again, before I utter this word, I want to clear the myth. There is no robot that performs this surgery. It's entirely the surgeon who uses a computer-aided assistance to be able to do this surgery. And then why we want to choose this surgery is basically because not just to make somebody comfortable, but these technology gives us a better vision, better, more precise way of doing. And because of this precision and better vision, we are able to do a more complete and better surgery and give better clinical outcome to women.
Can long-term use of painkillers for period pain have any negative effect on health?
Yes, long-term use of painkillers can cause kidney damage. So you should be careful into what you're taking. So that's what I said. It gets intractable that you're requiring large number of pills. Then you must seek a doctor and get the disease reduced, at least by surgically, and then go on.
How does menopause affect pelvic pain, ma'am?
If the pain is related to, say, fibroids or endometriosis, they tend to reduce when the menopause comes. Because I told you, the villain is estrogen. Diseases come down, but they don't disappear. But with menopause, one must remember there are other things that are coming up. You have a poor bone health that can result in pain. You have never exercised, so your ligaments are not strong enough to support your body, right? And so you've never done knee exercises, so that's why there is a knee pain. So I think women around menopause, if they pick up doing some kind of exercise, toning their body up, they will be much better off in terms of suffering from pain.
Ma'am, I have some questions for you from our audience as well. So, one person asks, I have severe cramps every month that interfere with my daily activities. Should I be concerned?
There you go. I already gave you that answer. There's an intractable pain that is interfering with their day-to-day activity. You must see a gynecologist, number one. If the gynecologist says it's not a gynecological problem, then we can look into other people. And in the corollary, I just want to say that something like endometriosis sometimes can present with abnormal discomfort in the abdomen, bowel discomfort. They may have pain during passing motion. They may not have so much pain in the periods, but they're having these problems. For these problems, they often go to other specialty people, mainly physicians or gastroenterologists, and they getting treated as IBS or some other problem, but they actually have endometriosis. And so there is a long delay in their coming to gynecologists for treatment. So I have this, we are talking to women. Of course, I'm going to give this information to women. But if any of my allied specialty doctors are also in this program, they must remember that if any lady comes to you with pelvic pain and you are not able to figure out whether, ask only one question. And that is, does the pain become worse during periods? So even if there's a pain during passing motion, if it gets worse around periods, it could be endometriosis. And so a gynecological evaluation is mandatory.
Ma'am, does endometriosis impact fertility?
100%. Now,
What
when I say 100% does not mean that 100% women of endometriosis will have difficulty, but this is definitely one big association that we find, that women suffering from endometriosis have infertility issues. And that those reasons are multiple. We can, I mean, in our lectures and our teaching, we tell them what are the factors. But the common reasons is adhesions. That means the pelvic anatomy gets distorted. The ovarian functions get low. So all this results in infertility. And many women with stage 4, stage 3 endometriosis do require help in conceiving.
Ma'am, if someone is undergoing IVF and they are diagnosed with endometriosis, is it imperative that they first treat endometriosis and then plan for their fertility treatments?
It actually is hand in hand, and each patient is different. So whenever a patient of endometriosis comes to a gynecologist, she must ask two questions. One, what is your symptom? Second, what is your desire? And then I will look into how much the disease is. If she is very symptomatic, doesn't desire a pregnancy, then medical treatment or surgical treatment is immediately offered. But if she is not so much worried about the pain, but she's worried about the pregnancy, then it is imperative for the gynecologist to be associated with a fertility specialist, evaluate that woman, and see that even without surgery, is there a chance of her conceiving with her ART or some others? If that is so, we must go for that line because her desire is pregnancy, not my surgery. But if the infertility specialist feels that the ovaries are inaccessible or the disease is so great that implantation failure will be there, then the ball comes back to my court to reduce her inflammation, reduce her disease as much as possible. And believe me, to my pleasant surprise, many of these actually just conceive on their own. So I love doing that, but I always have a chat with the infertility specialist. Never take it alone because that patient wants fertility. She is the primary focus. We cannot deny what she wants.
Ma'am, for painkillers which are used for treating pelvic pain, is there any alternative natural things which a person can consume to help or aid the pain?
You're asking the wrong person. You must have somebody from the naturopathy or the dietitian group to answer this question. But yes, lot of our food products are supposed to be anti-inflammatory. And the first thing that comes to my mind is cucurbituril, that is haldi. So you actually get haldi capsules, and a lot of doctors actually prescribe that haldi capsules for people to take to reduce pelvic pain during menstruation. But my take is different. I said, why not add it to your milk or do something and make that concoction and have it? So I think in the natural remedies, this is the only thing which I know has also scientifically been proven that, yes, it can reduce inflammation. So I don't know how much it works. I don't
Ma'am,
try
can you give
it.
us can you give us a few insights about fibroids and pelvic pain, ma'am?
When the fibroids are big, do not give pain usually. They may give pain if they are located in some areas of the uterus, and they will give a menstrual pain, especially a submucous fibroid. Submucous fibroid means fibroid which is inside the cavity of the uterus. So that the uterus considers as a foreign body or a baby inside the uterus, and they'll start to push it. So they cause severe pain called spasmodic pain. But when the fibroids become big, they press on your rectum, they press on your bladder, they press on your pelvic walls, or they stretch the ligaments so much, it can give pain.
Thank you so much, ma'am. And the last question I have for you today is hormonal therapies and
What
period
therapy?
pain.
Come again, what therapy?
Hormonal therapies and
Hormonal therapy, yes.
hormonal therapies
Okay, and pain.
and period pain. Yes.
Okay, so
How are they
hormonal.
correlated and how can we
No, no, no. That's a very, very, very valid question, because we do give hormonal therapy for pain. And actually, initially I mentioned that we give the first line of hormonal therapy that we give is contraceptive pills. Although contraceptive pills is commonly used for contraception, but it has been used for more than 4 to 5 decades now, and it gives very good control for contraception. But we found that women taking that for contraception actually also had reduced pelvic pain. People with heavy menstrual bleeding reduce their bleeding. So it becomes like a effective therapy as well. So that is the easiest and the safest contraceptive hormonal therapy that we use. The second is another contraceptive device called Mirena. So it's like a device, intrauterine contraceptive device, something the public may understand like a copper T, but it has impregnated progesterone hormone, which is released around 20 nanograms every day. And that gives a release of a lot of pain, especially in endometriosis. Apart from this, we have some progesterones, tablets, injections. We have anti-gonadotrophic injections. So these are all hormone manipulation to improve the patient's pelvic pain, especially with endometriosis.
Are there any side effects to these hormonal therapies, ma'am?
Yes, there are. As far as I would say, the first two that I mentioned, the contraceptive pills and the Mirena, do not have very strong long-term side effects, because they are actually made for normal women. If you look at the logic behind. So contraceptive pills is made for you and me who doesn't have endometriosis, but we take it for years for contraception. But for women having endometriosis, it becomes a therapy. So these two don't have much problem, but yes, we have limitations to how long we can use the other therapies. So there are some of them are guided to be used for 6 months to 1 year, some for 2 to 5 years. So we do not want to use these medications for too long. So if the disease is high, the disease burden is more, it is good to have a surgery, reduce the disease volume, and then take a low dose.
Thank you so much, Dr. Rooma, for this
Pleasure.
insightful and informative discussion. Your expertise has shed light on the complexities of pelvic pain and menstrual health, helping women understand when to seek medical help and how to manage symptoms effectively. To our audience, I hope you enjoyed the session today and you understood what endometriosis, PCOS, and fibroids and how they can cause pelvic pain. Thank you all for the participation. Happy Women's Day to everybody.
Thank you, Aisha. All of your audience can write to us if they have any more questions, and we'll be happy to answer them. Thank you so much, and happy Women's Day to all.